Now we are going to speak about the mechanism of chronic kidney disease. Now, for the mechanism of chronic kidney disease, you need to know that there are three major mechanisms inside chronic kidney disease. The first one is glomerular. The first one is, in this case, is vascular. Is it clear? It means that you can have a chronic kidney disease affecting the vessels. Is it clear? The second one is glomerular, meaning that you have a chronic kidney disease affecting the glomerulus. And then the third one is going to be the case of a tubulointerstitial. Is it clear? So in case of chronic kidney disease, we add both tubules and the interstitium together. Is it clear? Now, for vascular, you need to know that generally when you have a vascular chronic kidney disease, it's called a nephroangiosclerosis. Is it clear? Angiosclerosis. And vascular chronic kidney disease usually occur when you have if you have endothelial damage. Is it clear? When you have any event that can result to endothelial damage, is it clear? Is going to be associated with vascular chronic kidney disease. Any event that is going to be associated with thrombus formation. Is it clear? Any event associated with thrombus formation is also capable of doing a vascular chronic kidney disease. Any event, so those are the two major cases. Is it clear? If you have an endothelial damage or you have a thrombus formation, all that is summarized is in any event that can permanently drop the renal perfusion flow. Is it clear? Is going to associate with the nephroangiosclerosis. That is a congenital cause or any event that can result to an inflammation of the vessel. And lastly, you have congenital events. Is it clear? So all that can result to a permanent reduction of the renal blood flow. Now let's take the case of endothelial damage. Is it clear? So the events that can result to endothelial damage, you need to know that you have hypertension. So when you have a chronic hypertension, is it clear? Chronic hypertension is going to result what is called a benign nephroangiosclerosis. A benign nephroangiosclerosis. Is it clear? By the result of a chronic endothelial damage. Is it clear? Now you have the case of thrombus formation. Now generally you need to know that thrombus formation is instead going to result to much more resulting to a malignant, is much more resulting from a malignant nephroangiosclerosis. Is it clear? The malignant nephroangiosclerosis. Is it clear? And the mechanism via which you have this malignant nephroangiosclerosis is the mechanism of a thrombotic microangiopathy. Now, I want to explain what is this thrombotic microangiopathy. Now, you need to know that generally this thrombotic microangiopathy may occur in a chronic event, but is much more associated with acute events. Is it clear? So it's paradoxical. It's an acute event that continues as a chronic event. Is it clear? So you need to know that when you have a hypertension, is it clear? You need to know that this is the blood vessel of the renal. Let's say that this is the renal blood vessels with the epithelial cells, the endothelial cells located at that level. Is it clear? When there is hypertension, particularly malignant hypertension, when the blood pressure is more than 180 or 110 millimeters of mercury, is it clear, for a period of time, is it clear, of at least 3 months, if there is a hypertension of a blood pressure of more than 180 or 110 millimeters of mercury for at least 3 months, you need to know that it is going to result to shedding of the endothelium. Is it clear? So you're going to have shedding at the level of the endothelium. So what happens is that the platelets are going to block the shaded part of the endothelium. So when the platelet block at the level of the shaded part of the endothelium, they are going to produce a plaque at the level of the renal vessel. Is it clear? They're going to produce a plaque at the level of the renal vessel. Is it clear? And that plaque at the level of the renal vessel is going to be permanent. Is it clear? Which is going to reduce the renal perfusion. It's now going to reduce the renal perfusion, and that reduction in the renal perfusion is now going to be called a malignant. So it's going to be a nephroangiosclerosis from a malignant hypertension origin called a malignant nephroangiosclerosis. Is it clear? Now, the thrombotic microangiopathy does not just end here. Is it clear? What happened is that you are also going to have, since there is also going to be destruction, erosion, and endothelial damage, you are also going to have activation of the clotting factors. Is it clear? Activation of the clotting factors. And since you have activation of the clotting factors, is it clear? Just like activation, so the activation of the clotting factors, you are going to have thrombus formation. Is it clear? And thrombus formation can further occlude now these renal vessels. Is it clear? And this is the reason why you have now the thrombotic part inside the malignant nephroangiosclerosis. Is it clear? So this endothelial damage can result to clotting formation, clotting factor activation, which can further occlude this occlusion in the mechanism of a thrombotic microangiopathy. Is it clear? So those are the different elements. And then lastly, you have another mechanism in malignant hypertension from thrombotic microangiopathy, which is not associated with a nephroangiosclerosis, but instead associated with an acute tubular necrosis. Is it clear? How? You need to know that what you have also red blood cells that are going to collide at the level of this wall. Red blood cells, which are very large of this size, cannot pass again through this wall, so they are going to collide with the walls of this wall. Is it clear? To produce schistocytes. Is it clear? And they are also going to release hemoglobin in blood. Since it's going to be release of hemoglobin in blood, you are going to have destruction of the tubule via a toxic and intrinsic toxic acute tubular necrosis. Is it clear? So that was the first mechanism that was involved there. Which is the nephroangiosclerosis. Now the next one, we have inflammation. Under inflammation, if you have things like vasculitis, there are different types of vasculitis. You have polyarteritis nodosa, you have Takayasu arteritis, you have Schuster's disease, you have giant cell arteritis. So all these cells, one of the vasculitis, inflammation of the vessels, may result to occlusion at the level of the cells, resulting to a nephroangiosclerosis. Is it clear? Which can result to an increase in blood pressure. Now the next one, we have this other one. Now we have congenital. Congenital, now it can be a case of a congenital malformation of the renal blood vessels. And particular congenital malformation of the renal blood vessels, we have fibromyalgia. Is it clear? Fibromyalgia of the blood vessels, or you have a renal artery stenosis of the blood vessels. Those are the two major congenital defects associated with nephroangiosclerosis or vascular defects of the kidney. Is it clear? Now we are going to continue with the next mechanism, which is a glomerular mechanism of chronic kidney disease.